You're watching 12 on Health, and we're covering bladder cancer. It is the 5th most commonly diagnosed cancer in the U.S., with about 70,000 cases diagnosed every year. What's encouraging, bladder cancer is one of those cancers that doctors say can be easy to treat if discovered early. So let's delve into those warning signs and treatment options. For that, we have Dr. John Taylor here. Dr. Taylor specializes in urologic cancer surgery at John Dempsey Hospital in Farmington. He's also an associate professor of surgery at UConn Health Center. Thanks so much for being here.
Thank you for having me.
I know you go back and forth. You've got a lot going on and a lot of young residents learning from you. With bladder cancer, I understand there are varying degrees of the disease and types of the disease. But in any case, you want to get to it early.
That's absolutely correct. It essentially presents in two forms, or we can say two forms in two forms. There's high-grade disease and there's low-grade disease. Low-grade disease is akin to a nuisance tumor. They recur frequently, but they rarely have the ability to invade and spread. A
nuisance tumor, so once you remove it, the patient can feel pretty safe that they're okay?
Pretty comfortable that they're okay. They will most likely experience recurrences within 3 to 5 years, but it's improbable, not impossible, but improbable that they might actually develop a high-grade tumor, which can then progress.
Then the other kind is the higher grade.
Correct. The higher grade or the invasive, whether it's a superficial high-grade disease or a high-grade invasive disease, they're concerning. The high-grade superficial tumors have the ability to invade and spread, and that's why they're called malignancies or cancers. The invasive tumors may have already spread, and that's why treatment tends to be so aggressive, which is removal of the organ of origin, being the bladder, and sampling of the lymph nodes regionally to see how far or if it has spread.
Now, to get to those details, I know you have diagnostic tools. We want to show folks an animation and talk about how you are able to detect it.
Well, this would represent a possible papillary tumor within the bladder. The tumors can present in several forms. They can be carcinoma in situ, which is what I would assume Mary Lou had, which is a flat lining tumor of the bladder. Essentially, the bladder lining is replaced by cancer cells. You can have papillary lesions, which look like sea anemones, or you can have nodular solid tumors, which tend to be the high-grade invasive tumors.
And in many of those cases, it will require removal of the bladder, reconstruction.
For recurrent high-grade disease, which is at risk for progression, or for invasive disease, the standard of care is removal of the bladder with urinary reconstruction.
And when you do, is that something that is somewhat risk-free, or there are risks throughout?
No, it's actually one of the riskiest surgeries that we can perform. 1 in 4 patients will have some form of complication, but for the most part, they're minor. But it is a 4 to an 8-hour operation, depending on the reconstructive options, and a prolonged hospital stay and recovery period.
Waiting to see if it worked, because are you typically taking part of the intestine at that point?
We're using the intestine to reconstruct the urinary tract, be it as an ileal conduit or a new bladder or a catheterizable reservoir. All reconstructions are based on bowel at present.
And are infections a big issue?
They can be. Typically there's a period around the perioperative time where patients will experience more infections than not. But over the long haul, they tend to settle down.
Okay. Let's back up and talk about those early signs, because you're talking about early detection, and I know that's a big part of the Bladder Cancer Advocacy Network goal, is to get people to know about it early.
Sure.
Those early signs.
The earliest signs are typically blood in the urine, either visible blood or microscopic blood on a urinalysis check in the doctor's office.
So don't ignore that.
Don't ignore that. And certainly any visible blood in the urine should never be considered normal. And one of the biggest problems that we see in women is they're misdiagnosed and mistreated as an infection for months on end before someone finally realizes they might have a tumor or something else going on.
So they think they have a urinary tract infection, and the doctor might even think they do.
Correct. Based
on the symptoms.
Symptoms are very similar. Urgency of urination, frequency of urination, possible discomfort with urination, but lacking fevers, chills, or other constitutional symptoms.
Okay. Now, does this kind of cancer set someone up for other kinds of cancer?
No, not necessarily. The only risk that they would have that would put them at predisposition for other tumors would be the smoking,
right.
Which we all know smoking is bad. It's bad for your heart, it's bad for your lungs, it's bad for your kidneys, and it's bad for your bladder.
This is yet another reason to quit if you've already started. What's going on in the bladder? What's going on that smoking wreaks so much havoc?
Nobody's quite certain. We know that environmental and occupational exposure to carcinogens is the biggest problem. The exact carcinogen in tobacco smoke has not been identified, but it's thought to be an aromatic amine compound.
And those compounds are thought to stay in the urine and infect the area?
They get into the blood. The kidneys are our filter mechanism in our blood, and the byproduct of the filtration is urine. And the bladder is a storage unit for urine, so we have high concentrations of carcinogens in the urine, bathing the lining of the bladder as a storage device.
Okay, I can tell. The overall message there, don't smoke, obviously the #1 risk factor. Thank you so much, Dr. Taylor.